So I'm Donny Lawrence. I'm the Chief Operating Officer of Ochsner Health Plan. We are a provider-sponsored health plan based out of New Orleans. We're a startup plan, so we have about 6,000 members right now with plans to grow to about 15 to 20,000 over the next few years. We are an individual MA plan. We have a D-SNP that we've recently launched. Cognizant's been with us since the beginning. We have claims, member services, enrollment through Bpaas, and it's going on 4 years now. It was not cost effective for us to be able to bring everything in-house in both technology and resources. Cognizant had the resources and technology ready to go on day one. As a startup Medicare Advantage plan, our number one strategy at the moment is still around growth. And we of course care about operational excellence and compliance, but we have to grow ourselves into scale. And Cognizant's been there to scale with us over the past few years flawlessly. We've been able to grow 25, 30, and 35% year over year, and there's been zero blip in any service delivery. So we've been a partner with Cognizant for 4 years. I've been with Ochsner Health Plan for the last 2. And when I started, we met with the account team and decided that we really wanted to try to evolve this partnership into something a little bit more grand for both of us. And one of the things that we started with was a brand new transparent reporting package that had a weekly, monthly, quarterly rhythm, all leading and all lagging indicators. And service level agreements all combined, where we can actually make business decisions a lot faster to affect the business operations and the health of the business, as opposed to just the service level agreements that have been in the contract. So our partnership with Cognizant has always been fine. However, as we were talking through this and trying to evolve, we recognized on the Ochsner Health Plan side that we needed to really engage differently. And so Cognizant absolutely has the technology and resources and are performing our day-to-day activities well. We needed to alter our hierarchy and organizational expectations to engage with the teams differently. Between our account teams and the verticals within Cognizant to actually manage together, as opposed to just lobbing it over the fence and having it be a vendor relationship. So Ochsner Health Plan and Cognizant moved from a vendor-client relationship to one of more of a mutual partnership. And I think that was a pivotal moment in the cultural expectations of both organizations, which has led us to the results that we've seen. As we were reviewing our market, we were leaving too many opportunities on the table by not engaging into the D-SNP environment. In the greater New Orleans area, 20 to 30% of the folks there actually are dual eligible. So as we were looking to do a D-SNP over the next 3 or so years, we actually turbocharged that and attempted to do it within 8 months. So we called our friends at Cognizant and we were able to set up and establish a D-SNP within 9 months. And we didn't have any additional resources on the Ochsner Health Plan side. It was all absorbed with the technology and resources that Cognizant had. We absolutely looked at Cognizant for the resources at scale. But what we also looked for Cognizant with is more of a consulting type arrangement in helping us understand these lines of business that we've never been into before. And quite frankly, you guys are an integral part of our scalability and growth. So as time goes on, I expect more to be aligned within the Cognizant Ochsner Health Plan partnership and actually have more things together. The partnership between Ochsner Health Plan and Cognizant at the beginning was one that we needed a technology and we needed resources because we could not afford to do it ourselves. We could not afford to build all of this. I will say that since that strategy, it's evolved beyond that. We're actually making great business decisions, evolving the way we're doing things. Each organization is making each other better by finding things. We have a culture of, please tell us when something's wrong, as opposed to any punitive situations that might exist. And that's led to a lot of transparency and a lot of people raising their hand and offering solutions that they might not otherwise.